All new at 6, coronavirus not just impacting those who have caught the disease, but also those who need around-the-clock care. One Valley man finding out the hard way when he was left alone, stuck in bed for 12 hours. ABC 15's Adam Waltz has his story.
Tony Jackson has been working as much as possible from home during the pandemic.
On May 4th, 1943,
picking up voiceover gigs since his work hours have been cut.
Youngest and highest ranking officer at Selfridge Air Base in Michigan was in a drunken blackout.
The past 2 weeks especially have been extremely difficult. Tony is a full-time wheelchair user who woke up this weekend with no caregiver.
I was stuck in bed for 12 hours.
Tony was born with arthrogryposis, a disability that affects his joints and limbs.
Getting out of bed, going to the bathroom, bathing, grooming, meal prep, eating, everything that everybody does every day without thinking about it is something that I need help with.
Due to COVID-19, he's had gaps in care, especially after one of his caregivers tested positive for COVID-19.
I've had people say they were coming and then not show up, and so I have to rely on very, very good friends of mine.
Tony, who tested negative, says his biggest fear is not contracting the virus because he's not immunocompromised. Instead, it's what would happen if he or others with disabilities needed to go to the hospital.
We're basically reduced to a metric, and what ends up happening is we don't score very high on that metric, which means we're one of the last people to receive treatment. And my concern is that if I catch it from somebody, I'm going to be the last in line to receive treatment. But it's a risk I have to take.
He says there are many other wheelchair users like himself who are facing this same issue, wondering if a caregiver will show up to get them out of bed or just make sure they're okay. In Phoenix, Adam Waltz, ABC 15, Arizona.